Hey everyone, today I want to talk about two quite different perspectives or different ways of treating neurological problems. So just briefly, I'm going to explain what we mean by a neurological problem, and then I'm going to tell you different ways that we can address those neurologic problems. So most neurologic problems break into two main groups. So we have what we call ablative lesions and we have physiologic lesions. Ablative lesions are all of those things that are where there's been some damage to the system. So there could be a stroke or some space-occupying lesion like a tumor in the brain. It could be some brain injury like a traumatic brain injury, like a concussion. And that's a very, very specific group, and there's quite a lot of complexity in treating those types of cases. However, the vast majority of neurological conditions we call physiologic issues, where what that means is that the system itself, the structure of the nervous system, is actually all intact. Everything is there, but things aren't working quite as well as they should. So by analogy, what you could say is that imagine it like a battery, and the voltage is lower in an area of the brain, then that part of the brain and those functions of the brain won't work as well. So that's what a physiologic lesion is. And there's a couple different ways of treating that. So for the most part, most neurologic diagnosis is about trying to figure out where those parts of the brain and the nervous system are that aren't functioning very well. So imagining that there's voltages that are controlling everything. We know that our brain works through electrical signals, and we can see that different parts of our brain have different levels of activity. So if we find that there's an area of the brain that for various reasons, whatever reasons, might have a lower electrical level, that's another subject. But if there's a lower level of function in one area of the brain, then we'll see that all of its functions, whatever that part of the brain is doing, are also starting to fail. So part of the fun of being a neurologist is actually being able to see and understand what's going on with the patient, and to be able to deduce which area of the brain is involved. So there's a couple ways of trying to resolve those issues. One is by trying to, as directly as possible, treat that area of the brain, and that works very, very well. However, sometimes what we have to consider is that there's a whole series of connections within the brain, and there are areas that are not near that are actually feeding that part of the brain as well. So I'll make another analogy and say, for instance, that you could say that there's a problem at a subway stop, and that there's not enough people at that subway stop, and that might be for a variety of reasons. So what you could do is to try to force people down into that subway to get more people to use that subway station, but they might not be using a subway station or there might be poor movement in that subway station because the trains just aren't moving so frequently through that whole line. And very often what we'll have to do is consider what's happening at the other subway stations. And if we see that the other subway stations have some compromise as well, then we have to ask what the sort of precursors are. So very often it's not just pinpointing one part of the brain, but it's actually trying to deduce what's driving the train. In other words, the train itself, are the trains moving frequently enough to be able to make those subway stations work well? I'm really stretching the metaphor a bit here, but really what I'm saying is that sometimes an issue lies in a specific area of the brain, and we can treat that specific area of the brain. So it's sort of a direct approach. And sometimes we have to say, well, why is that area of the brain not functioning well? Is there something that's happening before that which is making it not get as activated? And that's sort of tracing things back. So these are two quite different camps. You think that they're kind of the same thing, but kind of the trends in neuroscience, particularly in functional neurology, have shifted over the years. I've been doing this for about 27 years now, so I've seen a lot of different trends. And one of the older trends is actually just tracing things back as far as we could. And one of the newer trends is kind of treating things very, very directly. And they both work. They both work very, very well. But I'm just going to give a little explanation of why I think tracing things back is an extremely important thing to do. Even if you're going to be treating things directly, we need to be tracing things back as far as we can to try to understand what it is that could be making that system not as active as it could. So Now, when we trace things back, what also happens is that things also branch off as well. So that adds a level of complexity. Sometimes looking at one area of the brain, you can't just sort of trace it in a straight line. There's also branches you have to follow back. But the best way to start looking at this is to understand that there are different types of information that are coming into the brain about what we consider transient things, or transient things are things that are kind of here one minute and not here the next minute. So sometimes you can see things in the daytime, and at night you can't see things. Now, most people know that if you don't use a neurologic pathway, excuse me, if you don't use a neurologic pathway, that it stops functioning as well as it could. So, and things can die. So if you don't stimulate something, that pathway will die. However, when we go to bed at night, we don't have vision, but in the morning we can still see. So there are what's happening in these systems, and this is a sort of rough analogy there, but what's happening in these types of systems where things are transient functions is that you have a paralleled activation of those systems through constant pathways. So in other words, pathways that are always giving stimulation. So those would be pathways that are sensing particularly things that are constant. And really the only constant thing we have to be perceiving is gravity. And also you could argue that we're always breathing as well, our heart's always beating. But it's really that sensation of gravity that is creating a constant stimulation into the nervous system. Obviously there's less stimulation or a different type of stimulation when you're laying down and sleeping, but you are always still getting activated by gravity. And these gravity receptors, these gravity sensors, are basically sensing gravity and turning that into electrical signal. And those electrical signals are actually going in and activating, and just kind of imagine like trickle charging all of these other non-constant pathways, all of these other transient pathways with vision and touch and sound, things that aren't there all the time, but we need to keep those areas of the brain alive and active. These areas of the brain are always getting some stimulation from these constant receptors. So it's really, really important, in my opinion, that we trace things back as far as we can. And when we trace things back, we find that the systems that are keeping everything else alive and keeping that bit of activation going everywhere are from these gravity-sensitive receptors. So where are those receptors? Primarily they're in joints, and because joints are really affected by gravity. When gravity is acting on us, our body senses the gravity. And particularly when we're upright, gravity is sort of pulling us one way, our body has to sense that and then move back, and then we end up moving another way, and then it moves us back. So we have this sort of constant movement associated with gravity, these sort of oscillations. We're sort of wobbling all over the place. If you could watch us really precisely, you'd see people actually move quite a bit. And those little sensations are actually being sensed in these gravity-sensitive receptors in our joints, and primarily in the spine, and to the biggest extent in our neck. There's quite a lot in the ankle as well, but the neck really has a lot of these receptors. So it's important that your neck is working well to be able to be as sensitive as possible, so that you're actually, all the joints are moving, because if those joints are moving, you're getting lots of stimulation from those gravity sensors, and that is doing what? It's driving those parallel pathways that are activating all the different parts of the brain that are non-constant. So again, just as a quick look back, we have non-constant pathways that we can stimulate directly. And to try to get those systems working better, it requires a lot of intensity, okay, and a lot of repetition to be able to make the changes that we need, because the receptors that are sensing these non-constant systems are a type of receptor we call phasic receptors generally. So phasic receptors are things that sense changes. Okay, they're very sensitive to changes, like acceleration. When you speed up and then you slow down. So speeding up and slowing down is sensed by phasic receptors, and those phasic receptors don't do well with a constant stimulation. So we need that change to get those systems active. So in order to use phasic receptors to make a long-term change in the nervous system, we have to have a lot of on-off stimulation. And that's basically things like exercises that we're doing. So when we look at rehab, what rehab is doing is rehab's focusing on phasic receptors, and hopefully that rehab routine is specific to the area of the brain or the part of the body that needs more activation. So that's how that whole perspective works. If, however, that at the same time there is this non-constant pathway system, which is not getting enough stimulation, what we call aberrant stimulation or poor quality information, I'll get to that in a second, then that poor quality or lack of information is going to affect that extra bit of that trickle charge that's keeping those other areas of the brain functioning to their best. So what I mean by aberrant or poor quality information is that we were talking a minute ago about how these gravity receptors in our neck are very, very important to activate that system, to activate those gravity sensitive things and keep that constant stimulation going into the brain, keeping all those areas alive and active. But if we see that the joint isn't moving, or the joint is moving poorly, a way it's not really designed to move, then it's going to give either less stimulation or poor quality stimulation. So what's really important when we're trying to resolve joint issues is that we get the joints moving the way that they're meant to move. This is absolutely crucial because that will allow us to be in control of the quality of an information. If the joint is stuck and we get it moving, we're increasing the amount of stimulation, what we call the frequency of firing of those systems, of those pathways. So you can increase the frequency of firing, so the quantity is good, but we also have to increase the quality of that information, because the quality of information has a lot to do with how we figure out where we are in the world. So if some joints are moving very badly, it kind of confuses our brain, to say it very, very briefly, of where we are. So in order to be able to control other types of functions, if we don't know where we are, it throws off a lot of other systems. And I go into that a lot more in other videos. So again, there's two ways of dealing with it. One is with an intense type of stimulation of phasic or transient types of pathways that's very specific, or we can get a stimulation of those constant pathways, which is going to make sure that the brain is getting quality information and also the same quantity of information that it needs to help create enough energy or electricity to drive those systems. Because ultimately, when our body is moving, we're turning different types of movements and environmental information into electrical signals. So it depends on what type of electrical signals we want to get. So this is really just two different perspectives of treating things, and we can absolutely do both of them. I'm seeing sort of a little bit of a trend of people focusing on specific or distinct sort of areas of the brain, and at the same time not really understanding how to treat those constant pathways. So one of the things that I stress a lot in what I teach and also in my practice is I want to first make sure that those non-constant, those gravity sensors are getting really good quality information and enough information that is going to drive those pathways. And what we see when we do that is that the whole brain just lights up a bit more. Everything just gets a little bit more switched on. And then treating those other imbalances which are specific actually become much, much easier because we've already gotten a lot of the work done. And we know that when we stop doing the exercise that we're not going to lose a function because those other parallel pathways are going to be activating this whole system or large parts of the system. So that sort of mix of those two perspectives generally works very, very well. So this has just been a quick little introduction to two different ways of doing things. That sort of gravicentered, graviseptic, I should say, or gravity receptor specific perspective, that's a mouthful, is kind of an older way of looking at things. It is not necessarily any less relevant now, but there has been sort of a shift because we're learning so much more about different parts of the brain and figuring out different ways of accurately diagnosing different functions in different parts of the brain. So it's a lot of fun doing that, but this is really just saying that we really need to consider both perspectives because we do need to use both perspectives to be able to create those long-term changes. So anyhow, I hope you found that interesting. I have more videos on all of these different things about phasic and tonic and about gravity and about joint function. So you just tune into my other videos if you want more information. If you don't see what you're looking for, just drop something in the comments and I'll be glad to make some more videos. Thanks for watching.